I answered yours.
Yeah, I'm thinking about moving it to the 22nd.
I don't know.
Yeah.
Carry the sweater, please.
My own. Yeah.
Hard recover, no.
I feel that. My core.
$14.
This is how rumors get started.
That's how rumors get started.
This covers the family.
For Mary Beth's.
Yeah, her phone was always on.
Like 4 minutes ahead.
We're ready on her time.
Five minutes early.
Yeah, right.
Great.
Finally in order. Good afternoon, everybody. Welcome. Trustee Jones, thank you for being there. We see daylight in Hawaii, so.
I appreciate these 1 o'clock meetings. They feel a lot better.
Yeah. We aim to please sometimes. All right, we are going to pick up where we left off. We'll walk through the remainder of the requests that we have, and then we'll go back and look at those that the trustees put asterisks next to. Jennifer probably has some information to share about those asterisks. Perhaps we'll close this out today, but we're under no compunction to do that if there's further discussion. So we finished last time with Sunshine Physical Therapy, so we're going to start with the Hope for Family Center. I saw Marty is online. Thank you for being here today, Marty. Okay, Jennifer, will you get us started?
Okay, so the Patient Navigator is the first program. And they were requesting 31,319. Did you want me to go through the trustee recommendations from the evaluations? No, okay. Just a second.
Okay, and we see that there's the annualized number there. As that they received an off-cycle request, allocation as well.
That's correct, yes.
Discussion about,
I had recommended full funding.
okay? Others,
Full funding.
trustee Westcott,
I'm on the same page.
trustee Mackett,
Concur.
trustee Jones.
Full, full funding.
Okay, I do as well. So 31,319 is the consensus. Okay, next.
Okay, so the next one on your list is the medicine technician. And they are requesting $43,086. They did reallocate some of that funds to offset the Patient Navigator that they were trending over. And they are currently trending at like 14,243.
Yeah.
Mhm. So the request is significantly higher than what they received and where they are trending.
Why are they trending low on this one? Medicine technician. What was the reason? Does anybody have that?
Yeah, I
Sorry.
honestly don't have, again, it could have been just a, projection from first time going fee for service and it's not meeting.
This was in February.
Yeah, and yes,
Do you want to ask Marty?
Yeah.
yeah.
And well, Marty's gonna have the floor, I think this has been a prior subject conversation. This is someone, it's been a while since I've looked at the actual description, so working from my memory. This is someone who oversees medications for their residents to make sure that they're administered properly and safely. And one of the questions I think that has been an undercurrent is that a single hat? Is it necessary for a single hat
Correct.
to be worn to do that? Is that a responsibility that can be shared elsewhere?
Right. That was a similar question that I had this year again, yes. Marty, could you address, the annualized projection significantly lower than budget?
Yeah, so during that time, we were still transitioning into the new space, which meant we had fewer residents for a little while. And then honestly, just trying to predict what was going to happen moving forward after the expansion and the move-in of the residents. I think we'll have a true and honest projection coming up in this year. But we went, from operating to like 15 families, because we also had our offices inside the old shelter, to expanding out into the new shelter and training staff to get up to that point. And then we also are seeing some families that are not needing as much medication, and some families that are taking a ton of medication. So it's a hard trend to predict, and this is all new to us, the fee for service. So we were doing the best we could with the information we had, as well as the moving into doubling the facility size.
Trustee Deagle.
So the way that you're doing this fee for service is you have a medicine technician who administers medicine, and the encounter is how many medicines you administer.
Right. How many times they come to the desk? Yeah. How many times they come to the desk for their medication. And this is done by a support staff that is trained specifically to do that. So the med tech not only administers the medication, but also is there to assist them with other things they may need from the support staff office. So we also do drug testing at that time, and we do breathalyzers. There's a lot that goes on there at the same time.
That would be really difficult to annualize, to figure out, because every patient would be different. I mean, that
Yes,
comes in,
that's
it's
the
not
biggest.
like- Yeah.
That's
so
the
it'd be
biggest
hard
problem.
And to be clear, we're not paying for the
Budget.
FTE.
No, we're
paying
not.
for
I
the
understand that
dispense.
now.
Every time a med is dispensed, there's a certain charge associated with that fee for service. And then there's gonna be a fluctuation in volume, not just based on census, but by the different families and who's on meds and who's not.
Paula Westcott, the person that does this, what other duties do they have?
They're also support staff, so they have to certify as a med tech in order to administer the medication. Support staff is basically people that are living with them through the hours that they are on working. So they assist with anything that is needed, making sure they have their meals, making sure that they have other resources that they need. If we need to administer a drug test, we have the support staff do that. If we need to do a breathalyzer because we suspect someone may be intoxicated in the shelter, they do that. They also assist with the children and their medication and their needs. So they're basically there to make sure everybody stays on task in the shelter, as well as gets all the resources that they need.
So this is a general person that's gonna be there, there's gonna be somebody
Yes,
there
sir.
24/7. And this is one of the functions that this person does.
Yes, sir.
And if you were to assign an annualized dollar to the individual wearing all of those hats, what would that be? In other words, how much of the pay would that be?
Well, they make anywhere from $15 to $18 an hour. Majority of them are part-time. And the medication does take time, because we not only help them to administer the medication, but we also record that the medication had been taken, and we also count pills to make sure that the pills are accurate in the count that we have in the book, as well as the count we have in the bottle. So I would say probably 20% of that $18 an hour is part of the support staff's job.
Thank you.
And we also, this person also administers over-the-counter drugs. So if Johnny has, a headache, we give them aspirin. We don't allow any medication in the rooms. And that is because we are afraid, because everybody's living so closely, that somebody will not put their medication away right, and it could result in an overdose by a child. That's our biggest concern.
Understood. Thank you.
Trustee Mackett,
Yeah.
Dr. Mackett speaking. Well, if I just did the back of the envelope math for what you just said, Marty, and that's like $8,000 a year. It's not 43. So.
Well, we have more than we have more than one person that does that, and you also have to understand that they're there 24 hours a day, 365 days a year. Medication just doesn't happen through the
It's
daytime.
3
We have
times.
nighttime.
It's 3 times that, so it's 24.
And now that we have the 2 shelters, we have 1 med tech in the new shelter, the W shelter we call it, and we have 1 med tech in the old shelter. So there's 2 med techs on site the entire 24 hours a day, 365.
So it's $2.81 is what you're saying per. What do you call
Per
it?
encounter.
Per
I had $3,
encounter.
but yeah.
Yeah, $2.81
Yeah.
per encounter, and they're saying it's 15,000 encounters, and that's how they came up with that number.
Mhm.
How they got the 281, I don't know. I guess that would be dividing what
Correct.
the amount budget is, and that was probably from the salaries.
I'll jump in and say I made a recommendation of 30, thinking I knew they were gonna be doubling kind of numbers in shelter based on the way they were trending in terms of year-to-date expense. I also made a note, we made the note last year, we're the sole funder for this program.
Mhm.
It would, you know me, I'd be out there doing that, but.
I would go
That was
along
the
with
number,
you, Mike.
that was the number I worked with. If using Dr. Mackett's math there, I mean, 2 people, I mean, you got to 24, that'd be,
Well,
you know,
24 hours covered.
yeah, exactly. I think it's a number that seemed, the logic that I use, that's the
Yeah.
bottom line.
I can go along with Michael's recommendation.
Yeah, I was gonna say no higher than the previous approved, so no higher than 35. I can live with 30.
Figure for me, please.
I recommended 30.
30, thank you.
Trustee Jones?
I'm okay with that.
Trustee?
I heard Dr. Mackett say 35,000.
I was going to say no higher than
Oh,
what we
okay.
approved last
Okay.
time.
I can go with the 30,000.
I as well, 30, okay? Great.
Okay, the next program is the medical transportation. And for 26-27, they're asking for $1,122, which is less than their current request at $3,913. And they're trending annualized probably around 2,808.
Conversation?
I'm fine with that.
I was at 0. As I was last year, I think they're
Right.
spending more time and money. In writing this application and tracking data for, I know any dollar into a nonprofit is valuable, but I just. I don't see the benefit here for us necessarily.
No.
Wow, I've got to disagree with y'all.
Go for it.
Okay, well, I just know how important medical transport is, and I know where. And let me tell you, $28.05 or whatever it is, 50 cents, is 5 cents is an outstanding, it's a very good rate for medical transport. If these individuals are not transported through them, I don't know how they would get to medical appointments. And I have always said that you can have as many services in this community as you like. You can provide the best quality of services, but if you can't get them to the service, what's the sense in having them?
And, I don't disagree with a thing that you just said, but I believe $1,122 is something that this organization would be able to raise elsewhere. I don't see us funding $1,122.
Marty, Dr. Mackett, are you guys on the goal line?
We are, we have a goal line right outside of the shelter, but these transportations are not goal line specific. This is someone that has 3 or 4 sick children and cannot get on the bus, or somebody that has just moved in that needs severe mental health resources to take them to where they need to go. That's why the number's low. We have trended and shifted to using for their insurance the Uber program that a lot of them have. And we help them get sustainable so that they are using the goal line and they are using their insurance. These are cases that are tough cases that we just need to get them there at that moment. So maybe the terminology should be emergency medical transport, because they don't want to use an ambulance. We force them to use an ambulance if something happens. We had to do that Sunday night. But, you know, if they're right on that fine line, they trust us more to put them into our vehicle and take them and stay with them in the ER than the medical community. We're still building trust at this point when they're coming into the shelter with the medical community and the relationship with the mental health providers. And we're that soft, gentle handoff.
Hello, Scott. Jennifer and Don, you have to audit this the same as any other funded program? Okay, yeah, Michael,
Yeah.
I had not thought of that.
That's Mike Kennigan, I have been introducing myself. This is I'm flashing back, as I always do, to many years in the nonprofit world as another funder. There was a point in time where we determined we wouldn't accept a grant application under a certain amount. And I'll be honest, I don't remember what that ended up being. But in all fairness, in terms, and not just us, I think on their side, I mean, this is a service that is important. They've got a $20,000 budget and they're managing to do it without, you know, I don't know if there are other funders or not, I don't have that information in front of me, but I don't think it makes sense for either of us.
Trustee Jones?
I actually recommended full funding. I think this is an important service and it's not enough money to make much factor in our budget.
That is true.
I recommend full funding as well.
Okay, we'll go around the room. I cannot support that. Full funding. My, trustee Kent.
I'm at 0.
Full funding.
3 to 3. I was not gonna say.
Dana, what you're doing that,
So
we
I think,
continue the conversation?
yeah, we continue the conversation because there is no majority, so you can't say it's one or the other. So I think if there's any additional questions.
I have a, this is, Carrie, I want you to always participate, so this is
Okay.
trying to nudge you out, and it's gonna go the way, but under Robert's rules, the chairman doesn't vote unless there's a tie under no normal circumstances. We're a different entity. Does that rule apply to us?
So that's a good question. So if that's the case, then we would have 2 to 3.
I'm okay. I'm just trying to figure out how to solve the problem.
But based on that, I mean, we have to go back and look at every vote we've done.
We haven't done it.
That she's
We've never
voted
done
on.
it.
So that
Never,
would
ever.
kind of upset the way the budget consensus has gone thus far, and because it's consensus as opposed, I know we're voting. But I think for that purpose, because it is consensus versus a true full final
Understood.
vote. That we can continue with doing things as we have.
Um,
And trustee Mackett?
yeah, Dr. Mackett speaking. To me, this is de minimis. These are patients that appear to be in extremis. I agree with Michael, maybe we should set a minimum limit for a grant application, but to my knowledge, we don't have that now. Yeah.
Correct.
So,
And my sole concern, Paul Westcott, has to do with managing workload. Um, so. I'm fine with pushing it through and developing a policy. as a
That's
result
just
of
where I
this.
was gonna say, we don't argue about $1,100 in this instance, but I think we should avoid it
Yes.
in the future.
So just ask for more next year.
That's not what I said.
Oh.
It could be construed. Yeah.
Okay, last program for the Hope and Family Center.
So the last one is the intake coordinator, case manager, and they're requesting 8,862, which is a little slight increase from this year, let me take that back. They did reallocate additional 5,000 to make it 12,702, so it is less than the current. And they are turning around annualized at 10,432.
Discussion? Michael, what did you?
I know the full funding.
Okay.
concur.
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 Sorry.
I agree.
Okay. As do I, I'm continuing. 8,862. Okay, great, thank you.
Thank you, Marty.
Thank you, Marty.
Thank you.
This is Frank, so the total for Hope for Families, just so we're all on the same page, the total $71,303.
All right, Thrive.
Okay, so their first program is the Prevention Works program, and they are asking for 275,000, which is a little bit above their current year at 250,000. And I believe that they anticipate, with the opening of the new intake center, they're gonna have some more encounters.
Almost double, if I
Mhm.
recall the application.
All right,
Full funding.
trustee Kent,
I can agree with that.
trustee Westcott,
I agree.
trustee Mackett,
Concur.
trustee Jones,
Full funding.
as do I. P75.
All right, the next program was the Recovery Works program, and they are asking for 508,000 for next year, which is an increase over this year at 420,000. However, they are currently running higher than that at 489,940 annualized.
Trustee Kent,
My number was 475,000. That's 62.5% of the requested increase. I know it's not quite up to what they're trending right now, but minor notes are irrelevant here.
I say full funding.
other discussion?
I actually recommended 460, which would be about a 10% increase.
I don't have the notes. Where are we in terms of how much of this budget are we funding? I didn't write that down this time.
We're at about
Request is
508.
about 30% of the total program budget. 29.7.
And the cost per encounter?
158.75.
What's that?
158.75.
Actually, they projected flat encounters, I think. All right. Okay. At least that's what I had in my notes.
They put 3,200 encounters. I don't know if that compares to last year.
I think it's the same.
Mhm.
I could be wrong.
Yeah, it's actually, they're 3106 current, you said, it's correct, yeah.
So flat number of encounters?
So the increase
They're
would
actually
be
running
cost.
below it, is what you're saying.
Right,
Oh,
Yeah.
and below.
Track.
Okay.
2 months
Okay.
left, with 2 months left.
Okay.
Yeah.
Oh,
Oh, okay. Well, probably did 30.
Can we ask Carly to confirm that number on encounters, cause I.
Yeah.
Yeah.
Oh, we love that, we love that. Confirm that
She
we're
on
flat.
the-
Yes.
Oh, okay. Kylie?
Yes, I'm on the Zoom. Can you hear me?
Yes.
Yes.
Yeah, so at the time of the application, we projected a flat encounter rate of 3,200. In the supplemental document we had provided to the district, it shows that we are currently trending somewhere between an annualized rate of 2,900 to 3,600 encounters based on this year. So trying to just keep a conservative approach to our encounters, we ended up around 3,200. This year, we are projected to go slightly over that. It's just because obviously with the natural ebb and flow of admissions, sometimes we have higher encounter rates, lower encounter rates. So this is the best way that we can calculate encounters.
Did I hear you correct? Currently, you're expecting it with that 700 encounter range with 2 months left? In other words, did I hear you correctly that you're gonna end at either 2,900 or 3,600 by the end of the year?
The 2,900 to 3,600 is the range if we look back at our encounters from the last 3 years. So that's because that's kind of, I look at organizational history
Are
to
you
make our
currently at
encounter.
2,900?
And when I do an annualization, with 2 months left, it looks like they'll maybe hit 3,727.
Okay,
So
thanks.
that is higher.
All right, that helps.
Okay.
And so their annualized year-to-date projection is gonna be 489,940 on this,
Mm-hmm.
so they're above what they had. So I go for full funding.
I'm okay with full funding.
Trustee Macker?
Concur with that.
Okay, so, believe we've got three full fundings.
Yep. Alan was 460. Michael, what was yours?
475.
75. So
So.
full funding. Yeah.
Yeah. 508.
All right, the last one for Thrive is their drug testing. And they requested 30,000 for this current year, and I'm sorry, for the next fiscal year, and they are currently trending lower than their request for this year at 16,200.
This is the Camp Haven specific testing, right? Yeah.
But not just Camp Haven, they also do to Thrive, yes.
But the number you gave us, the 16,200 is the whole program.
That's for their
Projection.
annualized projection right now, year to date.
There gonna be a difference next year that they're doing something more.
So
That's
the,
just-
so it was written in the proposal, this year, we've only been doing this for Camp Haven. But there are other groups like Dynamic Life and others that are running nonprofits that are running into issues with getting consistent testing, and part of the barrier has been cost. And so they're relying on less reliable cup or dip test where they would like to use what we do with the lab testing as a better standard. And so what we would like to be able to have the opportunity to do is on a need basis, expand our assistance beyond just Camp Haven, but to other nonprofits who are also providing housing and testing as well.
So are we already in the budget that we've done with the Dynamic Life that you just stated, have we provided funding to them
Not for
to
this.
do these testing?
We don't.
We don't fund that. Okay, that's what okay, fair enough.
Well, do we know that? It's Paul Scott, because for instance, when we write a check for a scholarship, what all is included in the cost out of that scholarship? Do we know?
Yeah.
I don't.
I mean, so to answer the question, this is Frank, we don't have a specific line item for drug testing only for Camp Haven.
That would be, for me, that would be something that I would like, if it starts to happen, because it sounds like you said you would like it to happen, that would be wonderful. I think that that would be something that you could come back to us so that we can then make sure that we don't have it included in our funding for the others already.
They could charge them.
Well, they could. They could charge them and then we're paying that, well, but we don't know what the flow is at this point, so I couldn't make a call on that, but
Yeah.
if I know what Thrive needs for their individuals, I don't have a problem full funding for that, but not funding on an assumption that something's going to happen.
And really where this was born out of is there are more than a handful of times we've got people in our lobby crying. I can't afford my drug test, or I don't wanna lose my housing, or I don't wanna lose my treat, and drug testing isn't something we get grant funding, because we're not building the state for that. And so sometimes we have people in services are in the lobby crying about their drug testing, and so we just saw this as an opportunity. Just like we're checking blood sugars for diabetes, we need to be monitoring people's substance use and intervening if there's been a use to keep them safe in their housing and on their recovery path.
Trustee Matthews.
Yeah, Dr. Mackett speaking. I would propose that we fund them at the approved budget level for this year, which is 22,789.
So flat from last year.
I was gonna say 20, but I can do the 22 and change.
Trustee Kent.
I just had a follow-up question with Carrie. I'm assuming that when they're in your lobby under the circumstances, the eligibility is determined as part of the process.
It is. Yeah. The financial eligibility for all of our clients is something that we pull financial peeps form, and verify everybody. We have a sliding fee scale. The sliding fee scale does not go into our testing, and again, we receive no state funding or other funding from testing. It's self-pay, or the agency that is requesting picks up the fee. And we do have some individuals that in indigent nature who just can't afford that, and they risk violating their housing or other sanctions at times. And right now, we're providing that service for Camp Haven, which we started just last year, but have seen the opportunity and the need to expand that.
If I could just point out, Don just looked at Dynamics, and they do have a line item for drug testing. So if I could, that was again in February, so things may have changed. So if you'd like, I can follow up with Dynamic to see if they're doing their own drug testing.
That might be unwinding some things, so,
Yeah.
yeah.
We do need to know that,
Okay.
how that's all going down.
I'll make that request and put that too.
Okay, what did you say, trustee Kent? Did you?
What was, that?
22,789.
Flat from last year.
I can go there.
Trustee Westcott, did you
Yeah.
say? And, okay, I'm losing track now. Trustee Jones.
It wasn't clear to me where you all settled. I had recommended full funding at $30,000.
We're at 22,789, level from last year.
Okay, I can go with that.
And Michael, I have a question about that. We're not limiting Thrive to just doing Camp Haven tests then? I wasn't.
Didn't hear that.
We backed into this way
Yeah.
that isn't good, but I get where they're at. And if it was in the application, I don't remember reading it, to be absolutely honest. But I don't have a problem with that. I just,
Okay. So, consensus is 22,789.
okay.
So the total for Thrive consensus number is 805,789. 805,789.
Okay, and we're gonna go to first community, we're gonna have to ask.
I have to
Yes,
repeat
amendment,
it.
yes.
You-
Well, the belongs together. I don't know.
Okay, thank you.
Please do it.
Yeah.
I mean, you have to sign it.
Okay,
I couldn't hear. Did you say what the total was for Thrive that we just approved?
It was 805,789. 805,789.
okay,
Okay, so the first program is the medical health with primary care services. They are requesting 2.118, which is a decrease from, well, sorry, I forgot, but yeah, a decrease from this year, which the current year was a 2.5. Sorry, I'm looking for the wrong line items. And they are trending at 2.2 currently,
Yeah, about 2.3, just.
so 2.3, and
Yeah.
rounded up.
Yeah,
I recommend full funding.
Concur.
Scott.
I would agree.
Trustee Jones,
I agree. That's what I had as well.
I agree. Okay,
All right. Next one is the dental services, and you will recall that we did just approve, in July an increase to their current budget. So they are at 1.47 this year, and they're asking 1.67 for next year.
Full
And they are
funding.
trending a little higher than that currently.
Mr. Young?
I did move ahead quickly enough, and
Sorry.
we're doing dental.
Yes,
Dental.
correct.
Dental, right.
Trustee Westcott, no.
I'm fine with full funding.
That's not where I was, but I know the work that they're doing, and they were here recently, and they're the only game in town.
Only game.
So I don't have a problem. I'm, up to full funding.
Trustee Jones?
Well, I guess I follow the same logic as Michael. I had recommended a little less than that, 1.5 million, but it's important work, so I'll go along with full funding.
All right.
Just,
Go
okay. Paul Scott. I have their total budget. What, do we know the program budget for the dental program?
Dental is $8,138,200.
Yeah.
And we are only 1.6 million of that.
So
Which is.
I'm putting personal asterisk next to it just in case when we get to the end of this, we start looking at things again in light of Alan's observation. But I'm fine with the full funding at this stage.
Okay, but I hear an asterisk beside that.
It's that's just.
I
Hey, let's
don't
look
agree
at
with
this
the
one. Is this
asterisk.
where we could shave a little off possibly?
Yeah. Okay,
I'll put a P asterisk. How's that?
You do whatever however you want to reference me, you reference me. I'm okay with it.
behavioral health science services.
Okay, so, they are requesting 6,556, sorry about that. And they, did request additional for 701,467, and they're trending at 693,5 at this point, so probably not here.
I had a question on that one, Karen Deagle. I had that this was a $61 million program. I think it was on there. $61,333,300. 61,300,000. So yeah, okay.
$133.
Oh, 61 million, okay. No, where I got that from.
133,366.
61 million. Three what? Doesn't matter, but
6,133,366.
Just for mental health.
Just for behavioral health.
Yeah.
Trustee Kent.
I went with full funding.
Trustee Westcott.
I will go with full funding.
Trustee Jones.
I recommended 605,000. Logic being 519 last year plus 10% plus 6% patient increase. That's how I got to that.
very logical.
All right, Alan, you convinced me. I'll put another asterisk next to that in case we have to come back.
Full funding on my part.
Alan, what was your number?
605.
Okay, okay, but for now, full funded. Right?
Sounds like
Okay.
that's where the consensus is.
656,818.
Right.
Okay.
And then the last is their new Women's Health Fund program, where they're requesting 300,000.
I'm fine with full funding. Scott.
Trustee Kent.
I'm reading my notes.
Oh, sorry, going too fast. Trustee Jones.
Yeah, I had full funding. It's a new program, so it's hard to know exactly what to do, but it's certainly a worthy effort.
Trustee Teagle?
Full funding.
I read my notes and they're all positive. I mean, this is, I appreciate the intent here. But because it's a new program, I thought $200,000 was my number that would give them a chance to activate, see where they're at after a year rather than full funding again. I was trying to make some trends as I went through the process. So that was the logic. Not based on the need, even just the reality of dollars. That was it, 300. Yeah,
And just so that we know, their current burn rate,
It's a new program.
What's new
We have
program?
So-
New program for next year.
okay, so we haven't spent a nickel on this one yet? I was thinking that we had started at
Yeah, we have
mid-year.
not.
Right.
Okay,
And they've got a negotiated rate with Bureau of Radiology. I mean, that means we've got the hospital involved. I mean, all of that's
It
good.
was a really.
All of that was good.
Correct.
So the total we have for Treasure Coast Community Health at this point is 4.750023. 4.750023.
You have last year's number just side by side.
I do, well, last year's approved, but
We've added more.
we've added, so their approved budget was 5,233,079, including what we added.
Okay. Okay.
So it was more by
Right,
500,000.
I'm hearing that.
Actually, their amended budget was 4,700,4,790.
Yeah, I think what Frank had was the mental health court from.
Oh, good point. Yeah,
Transitioned
yeah.
out,
Yes,
so
subtract out the mental health.
There was about 60,000 that we had paid while it was under
Yeah, sorry.
TCP.
What are you discussing?
Nothing.
Nothing.
That's what I was gonna say.
Nothing documented.
I can't talk about mental
I'm
health.
talking about Ireland.
No.
Good.
The total,
Total,
that you may want for your overall population.
Yeah, this is the total this is good. At this point.
Okay.
Okay, moving on to types and teams.
Yes, the general mental health services, and they requested the same flat rate as they did this year. They are trending a little low, but they've had some reasons for that as far as they had some transitions of counselors, so forth, so they didn't get to bill at their fullest potential.
right, they're the ones, around the holidays had the issues with patient
Correct.
attendance.
Maternity leave,
Right.
never not coming back.
I remember that.
Full funding.
Mr. Kent?
Yeah, I'm at full. I had a good meeting with Ann. We talked a little bit about this. I'm comfortable with full thing.
Trustee Westcott?
Full funding,
Steve Mackett?
full fund.
Trustee Jones?
Full funding.
Okay, agree, 629, 594.
Okay. Next is Visiting Nurse Association.
No.
Nope.
Early childhood?
Nope,
No.
that's sunset.
Sunset, okay.
Sunset this year.
Yeah, okay.
Sorry.
Got it.
So hospice is the first of the VNA. And they are requesting 301,000 this year, which is less than their current year request at 495,842. And they're currently running around 350,000. Yeah.
Go ahead. Ladies
I'm
first.
sorry, but can I go back to early childhood mental health types and teens? I just wanted to find out. Why did we, because it's mental health consultation, why did we sunset that? You don't remind me? Does anybody know?
I mean, I'm happy to say there were some programs. The discussion was around programs where it wasn't direct care delivered to children. It was professionals teaching teachers how to
Teachers.
manage classrooms, behaviors in the classroom. That was
Train-
To identify them early.
that's what we had the discussion on.
It was kind of a one-off. That's my recollection.
That's correct.
Total 1.7.
Okay, so hospice.
I was at level and because I verbalized last year the fact I was really disappointed in their functional expenses, this year's percentage of program services improved nicely. I pointed out, I think it's still at 66. Sure like to see it at 70 or above, but I appreciated whatever was done to better,
When you say level, what's the dollar amount? Because the prior ask and the prior grant were higher than the current ask.
I have 301090.
That's a full one.
That is full fund.
Last year they were at 495.
No, I don't know what I said. That's my number, 301090.
Lundy's over there in the back row going, all right. Trustee Westcott,
I'm fine with full funding on this.
Trustee Mackett,
Good thing we were all listening to me.
Yeah, ignore me.
Trustee Jones,
301090.
okay, and Trustee Deagle,
Full funding.
thank you, agreed. Home health,
Okay, so their current request is 248,000, which is an increase from last year at 185,530. They are currently trending though at 295,588, which is higher than their request.
Full funding.
Full funding.
Trustee Westcott,
Full funding.
Trustee Mackett,
Full funding.
Trustee Jones,
I have full funding as well.
agreed. 248.
All right, the last one is the mobile health clinic. Their request has increased to 540,000 from their this year's 481,778. They are currently trending at 436,667, so a little lower than their current budget.
They're trending at how much?
Trending at 436,667.
And now I'm looking at, my sequencing was off, so I've got a personal note, administrative 23%. I think, Michael, you touched on that. What, if you can help me with your observations, Michael?
The audit showed 66% to program services, 32.7 to admin. And 1.4 to fundraising.
Okay, not making me feel better.
It is improved from last year, why I wanted to point it out. I've got a long note here to myself, which basically says, clearly the mobile clinic's a longstanding partnership, we helped or encouraged or created it with them. I'd just like to see VNA find some additional funding. Right now, the request is for 89.1% of the total program budget. It's valuable. I mean, I get all that. I always think we should be sending some messages to the agencies as we go through this process, and certainly would like to see that. The number I used was 510,000 as a recommendation, but I'm only questioning it because what Jennifer just said, they're tracking at the end of this year to be at 86?
36.
Yeah, I mean, maybe they know something I don't know, but that seems like maybe an overreach.
Trustee Mackett,
I would propose funding them at the same level that was approved for this current year. 481,778.
I can agree to that.
Trustee Jones, did you hear that?
Yeah, yes, I had 475. 481 is fine with me.
Trustee Deagle?
Yeah.
And I'm okay with that.
Okay.
I said I had some concerns after,
So we have total funding for consensus funding for VNA, the Treasure Coast. 1,030,868. 1,030,868.
Whole Family Health Center.
First one on the list is their new bridge care program for underinsured access. Their request is at 295,488.
Question?
Full funding on my part.
I took the same tack on this as I did on the new program we talked about a minute ago. I thought 200,000 for a new program would give it a solid test. I thought it was an appropriate amount.
It has not started yet, as far as I know.
Correct, it's not, so.
I'll go with Michael's recommendation, because I understand what's being attempted, to me, it's unwieldy. I'm a little bit concerned about it, but I think, it's worth giving it a try, and I think 200,000 is a good try, good starting.
Mr. Mackey?
I think in my notes, I had recommended funding it as a pilot at 100, something like
There was
that.
a 100 that.
But I can go with the
200. Trustee Jones?
I recommended full funding. I kind of agree with what Paul said.
So you're at 200? You could be at
I
200?
think he said full funding.
Well, but he said he agreed with what?
Oh, what is me?
Oh, so you didn't go,
I went 200.
okay,
So, now, I don't know if you heard me say the 200, because there were two thoughts. One is it potentially being unwieldy, and the second thought was 200 being a good test.
okay. So trustee Jones, is that where you are?
Yeah, 200.
200, okay, thank you.
The neat thing here is, I mean, we talk frequently, uninsured, underinsured. This is hitting a niche that
Mhm.
we've never found a way to address.
Right.
I think Paul's right. It's going to be a real challenge, I think. And we talked to them about it, but it gives us a chance to test to see if maybe they can find a means, a mechanism, a structure to pull it off, because there are folks with insurance out there that are still being battered by the system. And its costs, so
Great, okay,
200 it is.
200 it is.
Okay,
Like motion.
the next program is the lab services, and they requested 184,992, which is an increase from their current year of 85,000. However, they are trending at around 168,868 currently
To year end.
to year end. That's correct.
Is that because of numbers or the fee is changed? Because I thought the proposal had fewer numbers, but
That is at the current fee for service rate this year.
so there's higher. That answers that question. Okay.
It's 23, not 50 for encounter.
Can you say that louder?
Oh, yeah, in the first 10 months of the year, there's been 549 encounters for lapses. Excuse me, first 9 months, I have not processed this month.
Yeah.
So they're predicting 7,872 encounters, and
Yeah,
you
that's
said
about
how
right.
many?
549, it may have been a change in how they define an encounter this year.
It's panel versus individual tests, Dr. Mack. It's the panel versus the individual tests, and we've been working through that with them.
So it's not apples to apples then?
Correct, it's not apples to apples.
Well, for Medicare and Medicaid, you cannot unbundle a panel. It's actually illegal.
Yeah, like I said, we didn't settle in on anything.
So they're at 170.
So they're 168,868 with bundling this year, correct? Because that's how they're doing it this year, is per
correct.
person, per encounter, whereas
Per test,
per test. So it's at
per
168,868,
panel, I should say.
Oh, so we
panel.
are paying per panel.
right?
Why don't we have Marie?
Yeah, so you-
Yeah, that'd be good.
Marie, can you,
Which is how you're supposed to do.
Marie, can you come to the table?
That's how we've been doing it for several years, yeah, per panel.
You guys want.
You can't split years.
Well, we didn't, we didn't.
Charge Medicare that way.
I mean, the rate or the amount is kind of basically almost the same, but
Jenny, I missed what you said on what the run rate is.
That was, Shannon gave the run rate. Oh, the run rate of the budget? Sorry, 168, 868.
So I just wanted to clarify that these are uninsured pensions, not Medicare, right? Completely uninsured.
Yeah, but my point is, if you wouldn't unbundle it for Medicare or Medicaid, you shouldn't unbundle it for our purposes, right? It should be for Pam.
Well, if that's what you would like us to do, we can do it however you want, but earlier this year when we met with the team, we had a higher rate. And that was the bundled rate, and then we said we would go to a lower rate. And do it unbundled, so we can
So
do it however.
we confused you. Is what
Well,
you're saying.
Yeah, we.
Well, to be clear, we didn't make any decisions on anything. The decisions will come once we get the final numbers. And then we'll have the discussions on fee for service.
No, I'm not talking about for the next fiscal year, I'm talking about in the current fiscal year,
Sure.
there was a meeting.
Yeah.
With our CFO, and we changed the rate because we said it was, we had budgeted at the bundled rate. And then we said we're gonna unbundle it, so we're gonna lower the rate.
Right.
So
So
I think that's what.
let's Paul Westcott, which makes me curious. If we were to annualize the portion of the year where it was bundled, annualize the period of the year that's unbundled, I'd like to see how those trends look. In other words, are we paying more now because, you know, the prior grant was 85, we're well over that. I'm just curious as to what dynamics are. In other words, so if we're currently paying unbundled,
What are we paying of the unbundled, by the way? What is a bundle?
So if you have a comprehensive medical profile.
Yeah. Mhm.
Right, you're paying for 20 tests,
Right,
right? But you're paying one rate for that blood draw for those tests.
right.
You can't charge for every individual test in that.
Right.
That's unbundled.
That's unbundled.
Right.
Okay, so this was doing it unbundled at $23.50 per encounter this
Yeah.
time. And so anybody that came in and has their blood drawn, is that kind of the idea here? And they had,
If it's a panel.
Yeah.
It should be billed as a panel.
Well, yeah, let me also be
So I
clear, in the
understand what you're
discussion, what we had was we want to look, because there's a lot of variability among panels. Panels have different amount of tests in them.
Sure.
So we sat down and said, okay, on average. We don't want to pay for more than 5 to 7 tests per panel. So let's take the average and figure and say, okay, if the panel cost is whatever we were paying per panel, we'll take the average of that to make sure that the fee for service payment was in the same ballpark.
but how do you know if the person needs more than 5 to 7?
The concern was when we had the discussion, we can't pay, we can't double. The cost of the district would be outrageous if we paid a significant higher rate per test. The per panel was the only thing that made sense, but we did have more discussion about it and say, okay, let's look at an average. Because the concern was, I don't want to turn $150 reimbursement into a $500 reimbursement. That was the concern.
Yeah, good, yeah.
Marie? Did you have other, based on conversation?
so how is it tracking for us? In other words, the
These guys
before and
have-
after.
I don't have the volume in front of me. Shannon does.
Currently, the lab services is being billed per test at $23.50 per test.
Right.
At that rate, 9 months into the year, since their invoice has not been processed yet for today, they are at $126,650.
Okay, how does that compare to last year when they were bundled?
I would have to do that analysis.
Yeah,
for you.
I'd like to know that
Yes, sir.
because I want to make sure that we haven't bought a pig in a poke. Not that anybody's done anything nefarious, but I want to
Yeah,
make sure
yeah.
that.
We
So I
have the
do
figures.
recall we looked at the prior year's invoices, and that's where we were concerned because it seemed like we were reimbursing at a lot higher rate than we were the previous year, so that's why we were having these discussions.
So can I make a recommendation that we go for the full funding, which is 225,000? Last year it was, oh, sorry, 184. And their projection, year-end projection is 168,000, so they're trending up a little bit more than. So if we do the full funding with an asterisk beside it, so we can have more information on this.
Right, and I would, if there's a way I can know what this year would look like. If they were bundled.
Well, we could back into it.
Yeah.
Yeah,
So I'm recommending full funding
With
with
an,
asterisk, with a big asterisk.
so is this a K asterisk?
No, this would be an HD, hospital district asterisk.
Okay. Trustee Jones,
I'll go along with Karen's recommendation.
trustee Mackett,
Okay,
I'm fine with that, but we're gonna put a second asterisk with my initial next. to it.
Okay.
The two asterisks in that one, Paul.
Two asterisks.
So can I have clarity on what it is
So-
that I need to report back to you?
So this is my concern. That by unbundling. We changed the curve on how much we're gonna incur over the course of a year
Okay.
to the disadvantage of the taxpayer. So what I want a comparison is what this year would look like if it was bundled
Bundles.
Mhm.
compared to what we currently have.
See where we come out, okay, I got it. Thank you.
Yeah, and this is Frank, let me just add, when we backed into it, we looked at the average test per panel, I don't remember, it was like 5 to 7. And so that's the ballpark we were in equivalent to the test, so we didn't, now it's not like there's all of a sudden a whole bunch of patients that they're gonna be running tests that. Are panels that are, 20, they're not gonna instantly start ordering all these additional tests to take advantage of that. Those averages were those averages,
Understood,
so that's the number we used.
right, but.
Yeah.
And we have last year's experience
Yeah.
to look at as well, which last year was 85,000.
Right.
Well, that was budget.
How much did we spend?
Well, we're tracking at 168,868.
68. That's right, I'm sorry, I might misspoke, I meant. The year before,
oh,
yeah, don't worry, we don't need to worry about that now, but that may be useful information for whenever we come back to it.
Yeah.
trustee Kent,
The number that we're looking at is full funding.
correct, we're gonna,
184,992.
With two asterisks.
I was at 150, but I'm not gonna argue this point. At this point, I think there'll be other argument coming up because of two asterisks. Um, I wanted to point to for all of the programs which has the same agency budget. The agency budget actually shows whole family health. With the net revenue profit over expenses of 2.2 million. And. That's projected, it's. They've got expansion, I understand all of that, I'm just pointing out the fact. That the budget coming up is pretty flush, if it's true. To the 184,992, I'll be on board.
all right. Mobile med,
Okay, so mobile medical request is 225,000, which is a decrease from the current year at 300. They are currently trending at around 212,200, so they're pretty much on target.
Full funding.
trustee Kent,
Full funding,
Full funding.
not decreased.
full funding.
trustee Jones,
I have full funding as well.
great, okay, 225,
All right, the next program is the pharmacy assistance program, and they are requesting 416,650. It is an increase from this current year at 385,250. Let me see.
And the burn,
and trending high.
Yeah, I'm saying, yeah, annualizes at 393,593.
right,
I mean, higher than.
Trustee Deagle,
Full funding.
trustee Kent,
I can do that.
Same, Paul Scott, same.
Same.
Mackett, trustee Jones,
I agree.
Agreed, 460, 650.
Mhm.
All right, the next one is primary care medical services. The request is for 612,125. They're currently, the budget is 500,000, but they are trending higher than that at 529.
Trustee Deagle,
Full funding.
trustee Kent,
Full funding.
trustee Scott.
And the basis, I mean, they're trending at 529, so we're seeing about an 80,000 or 88. Yeah, $80,000 differential. Any explanation?
We'll look at their,
Because if I recall, Dr. Mackett speaking, in the application, if the number of encounters was static, right?
they're projected, 2,303 encounters. They're currently at 1,352. They haven't, submitted this month yet. So annualized as of the end of July, it's 1,622. Actually, that was at the end of June, sorry. So we have it on July.
I actually misspoke. I put a number here that doesn't sync with my notes. I was at 600,000. Not full funding. They're not tracking as high as. And they weren't when I did this at 7 months. They're still not tracking even at 9 as high. So I was at 600.
Okay.
Just because I know the work that we have ahead of us when we get finished with every item, I'm thinking something around the mid 500s, 550, something like that, to allow some nominal growth. But if they're tracking the way that they're tracking, I'm not sure why we want to commit that much more.
Trustee Mackett,
Trying to see what I had on my notes. Actually, on my notes, I had 526, so I can do the 550.
Trustee Jones,
Well, this is, I think Whole Family's a fantastic organization. What
Agreed.
I'm noticing is the estimated cost per encounter is $295. Treasure Coast is $254. Now, they're different organizations, but the reality is they overlap. They need to figure out a way, in my view, to get together. So I just used the 254. And when I get to that, I get to 500. That's my
Okay.
number.
Alan, if I could just, this is Frank, guys, if I could just explain something. So the differential is actually $20. It's TCCH is $275, Whole Family's $295, and the justification for the variance is the fact that TCCH gets federal operating dollars as an FQHC.
That's
Whole
my
Family-
point. That's my point, Frank. That we need to figure out a way for both of them to be getting federal funding. The idea that one's more efficient than the other is, that's what we're having to fund. And
Alan, let me just
I
be clear
think they
that
need
the
to figure
only,
out a way to get together.
I apologize, the only reason TCCH gets the operating dollars is they're designated as a federally qualified health center. Whole Family cannot get those dollars. They're not
I
grant.
understand.
Okay.
I understand completely. I think
And
these organizations ought to figure out a way to get together.
Okay.
yeah, Marie,
So I just did want to comment about our medical funding and our billing just submitted today for the month of July, and we are trending even higher over budget for medical and behavioral health as well. So we're about 5% over budget through the 10 months. So I tend to think that we're gonna be even a little bit higher than what's annualized right here. So I just wanted to get that information.
Okay. Thank you for that.
550 on the table, is that what I heard?
550 on the table.
550.
I'll go up to 550.
And I'll come down to 550. I hope.
Okay, so we're at 550 is what I hear, correct?
Mhm.
Okay,
And so,
Thank you.
Okay, and the final program is the behavioral health. And their request for 26-27 is 320,075. Which is an increase from this year at 280,250. However, they are trending higher than that at 337,473 annualized. Yeah, and that's correct. They're actually 9 because I didn't have yours at the time.
Full funding.
How is it full?
Trustee Scott,
Full funding in light of the trend.
trustee, okay, Mac is a yes, trustee Jones.
It's full funding 320, that's what I had.
Yes.
20,005.
Yeah, okay.
Okay,
So the total for whole family health is 1,896,717. 1,896,717.
thank you, Marie.
Thank you.
Thank you, Murray.
I have to recuse.
Yes, you do.
myself.
One more time, that's Matt.
Okay. No, he's my last, so I'm like, this is fun. Okay.
All right, so the Women's Care Center, Caring Center for Women with their women's healthcare services requested for 26-27, 975,000. They are currently approved this year with their request at 910,000. And they are running at 826,800 at the moment for annualized.
And that is for 10 months.
Yes.
I had full funding.
Trustee Deagle, trustee Kent.
I had 925, but I have a comment that I'm going to make that you've heard before. This is a terrifically valuable organization who stepped in admirably. They've grown tremendously over the last 3 years. Their 16-member board includes a husband and wife, the CEO, and the man who's the treasurer. This is not illegal. This is one of the most problematic governance scenarios a nonprofit can create, though. It's absolutely not considered a best practice. In most instances, it'd be a major red flag for the IRS or auditors or funders. It just creates a conflict of interest that I think most governance experts would consider unacceptable. They've grown amazingly in the 3 years that they've been under our auspices for funding. And as it continues to grow, I think it's possible that conflict could come back and bigly bite them in the butt. It's nothing personal. These are committed individuals. I get that. But it's a real world that we live in, and as everybody else looks in, it's problematic for me, and it could be problematic for others if they continue to grow as significantly as they have.
Yeah, I mean, I brought up the first time that they came before us, so I have similar concerns. Trustee Deagle.
So I understand your concerns, but that's your concerns. Is it the concerns of our policies and procedures?
Right.
And that's how I have to vote, because if it is not concern of policy and procedures at this time, then there shouldn't be. We shouldn't have that concern.
Karen, this is Frank. If I just may add, when they first applied for funding, we had this discussion, compliance, Don would talk with legal, that the thing that made it seem, palatable is the wrong word, but acceptable, is the fact that they were not drawing salaries at the time. So they were unpaid. And again, they were also in for a lot less money, but they were unpaid. So I just wanted to just remind everyone of that. I mean, it's certainly not best practice. And we did consider that, but the fact that they weren't getting salaries, we talked about that. It seemed to make it a little bit more acceptable.
And does that stand that way still? Is that our feelings, or is that Dawn?
I mean, it is disclosed in their annual financial audit. It's also mentioned in my audit reports when I send it out.
Okay.
Just because I think it should be disclosed to everyone, so everyone does understand that. And like Michael said, while it's not best practice, neither one of them are compensated in their roles. We don't have a specific rule here at the district to
Right.
say that,
Okay.
So
you know, they should.
this is Paul Scott. I think this touches on something that is a long-term smoldering issue for us, and that is the degree to which we have a responsibility to make sure organizations are safe, even from themselves. And what I mean by that is we invest a good deal of financial resources from the taxpayers in these organizations with the expectation that they're going to remain viable and operational. Good people, this is not individual specific, this is macro that I'm talking. It is not best practice, because when you start having internal conflicts, this is a sort of a situation that tends to negatively impact rather than positively impact whatever frictions may exist within an organization. So I agree with Michael that it's not best practices, and it's, do we get minutes from them?
So
From their board
we
meetings?
do, and as we all know, we've had the conversation where our audits are going a little more in depth. As far as board governance goes. We also have the new Florida statute, all the new nonprofit rules that were placed, so I'm also assessing that to see how that's going to apply for our audit going forward, because there may be some additional areas that the district needs to look at now based on that new law.
Yeah.
So, I agree philosophically with Michael, but I think also until we put something in our contract
That's right.
and our rules, we're 29%. So what I've done quickly is I said, okay, assuming their total budget's 2.55 million. Of that, we contributed 350,000. We're adding 607,000 potentially to that. When I add that to the 607 to the 2.555, I get 3.162 million. In other words, if we give them their full ask, their budget goes to 3.162, assuming they don't get money from other sources. That puts us in the position of a 29% participation in their finances, which is getting into that area. Realize we're helping them invest in their growth. But I would anticipate that would be the apex. That we would see them seeing money from other sources, so their growth is supported elsewhere as well. That's the concern that I have with the ask. It's a pretty sizable increase. Great program, completely supported. This is just more.
But wait a minute, it's considerable more but we did give them additional 560,000, right?
Right.
Really? Yeah.
Okay, so we're
actually
close to
at
that.
910,000.
You know what?
And they're.
Thank you for clarifying that,
Yeah.
because now the 2.55, I'm wondering if it does include what that additional ask. I see that now. These were notes that I created some time ago, and now they're making sense to me. Thanks, Karen. Okay, less of a concern.
Again, I'm not in a position where I'm saying we ought not fund them.
Right.
But I think it needs to be on the record for ourselves. I think we need to follow up with this. It's just, they were a much smaller agency the first time that we met with them and funded them. And I do remember at least one circumstance where a similar situation in our minds, although it also was a new agency, we disqualified them because of
You're right.
That was a
the daughter
mother-daughter
coming in,
situation,
yeah, it
but
was a mother.
So both key positions in the organizations that were salaried.
Right, and I think the CEO and the treasurer are key positions in the agency, that's my point. Again, I'm not gonna interfere with funding, that is not the intent. And again, it's not personal, these are good people, but I think we need to address that issue somehow.
Trustee Jones?
Well, I think, I don't know, I'm kind of mixed. I understand what Michael and Paul are saying about the optics of this. But knowing Jerry and her husband, they volunteered to really help the community. And
Agreed.
what's happened is the Caring Center for Women has now become, because of their excellence in operation, has now become a critical factor in being able to provide maternity care through Cleveland Clinic and keeping it in our community. So I have absolutely no criticism of Jerry and her husband. The funding that I recommended was 910, which is about a 10% increase from what at least I thought was the run rate for this year. Also recognizing something that Paul has mentioned many times, that even today, that we're going to have some more work to do to try to get our aggregate budget in under our objectives. So that's, I wanted to make those two comments. I think Caring Center for Women, and I know you didn't mean it as any kind of criticism of the organization, and I understand the optics, but these two people working volunteer to create a service to the community, I think they ought to be applauded. It would not have any kind of implied criticism.
Thank you.
And Paul Westcott, Alan, I agree with you with everything you just said. The 910 is fine with me. Particularly, I apologize for some of my earlier comments because I misread my notes as to how much this current year was running. I'm fine with 910, and to be clear, nothing about the specifics of the persons or personalities that we're talking about. It's more as a matter of policy for us, having a plan that protects us, protects the taxpayers, protects the organizations, to the extent it's in our wheelhouse.
You have two at 910, Michael,
I can do 910.
910, and Karen, you're full funded.
Yeah.
Correct,
Mhm.
okay,
Which I think, isn't that?
975.
970,
975.
yeah, I'm at 975, sorry.
okay, so we have 910 is the consensus.
So that's, yeah, a total of 910,000.
Okay. All right, so now we need to go back, oh, now let's get back to the agenda first. Moving on.
Are we going till 3?
Mhm.
At 3 o'clock.
Yeah, I do too. Would you like 10 to 3?
It's up to all of us. It's up to these asterisks.
Yeah.
And.
Well, we've got a meeting on
Yeah,
Thursday.
yeah,
Wednesday.
have to do this.
What are we asking now?
Nothing.
Oh,
Yeah, I was just wondering, everybody go home, do your homework and be prepared Thursday to
Wednesday.
Wednesday.
Chairman.
Yes.
So,
What were you discussing?
okay, so. I don't understand, we were getting ready to go back to the asterisks.
Oh,
We had that conversation saying that it's 2:22, we don't, it has to be done with the process at 3, we can hold, continue the discussion at chairman's meeting. Trustee Westcott had another,
Well, I was just thinking, we can try, but I'd like to have a little more time to kind of strategize with the various parts and how they interrelate and how they fix the bottom at the bottom. That's not we've got another 20 or 38 minutes that we're here. I'm mental whatever you guys want to do.
I don't know how you would do your homework without knowing what the, I think we had some that asked, we had additional information, right?
Yeah. I did, well, the one that I actually asked for additional information was the primary care or the, behavioral health center, what the numbers were, and I did submit that to everyone, but I have the numbers here again. Right, I did send that out to all the trustees, but I do have that information here. That was, one of the questions for New Horizons.
Okay, can you tell?
Yep, do you want me to just go through them real quick?
Let me go back.
Okay, so the first one I had was New Horizons, where trustee Westcott requested information regarding the number of pediatric inpatient behavioral health admissions at Cleveland Clinic and Indian River Hospital. And I submitted that, they're trending, we're trending, at 2024, there was 304 Indian River County pediatric residents out of 326, which was a 93%. 2025 was 339 Indian River County pediatrics out of 489, which represented 69%. And then January through July of 2026, there was 162 pediatric Indian River County residents out of 246, which was 66%. So it's kind of trending downward.
This is Frank. Let me also add, I have to restate this, that the plan for this expansion was hatched before there was any discussion about any changes with Cleveland Clinic's peds behavioral health.
But it's still connected. In other words, we gotta,
I'm not saying it's not now.
Right.
I just want you to know that.
it's fortuitous.
And if I recall from the information you sent out, over 90% were insured or had Medicaid.
Oh, yes, yes.
Thank you.
Yes, that is true. That was, let me see, the, average length of stay during these, years were 3.5 to 4.4 days. And then noted that, yeah, Cecilia noted that, pediatric patients have insurance that covers inpatient psych care, as shown in the chart below. And yes, it was, when did you see that percentage on?
So the inference is while a large number of patients may shift, dollars are gonna be following them.
Right, but it's a lower rate.
Yeah. But also specialty service. I mean, they are specifically, Alan and I were just down there, they are specifically trained to manage these children as young as 5 years old.
Right. Madam Chair.
Yes.
Yeah, Dr. Hackett speaking. I would like to know where we are with the running total, because in my mind, if we have a closing on October 21st, would be August,
I'm sorry, it's my fault.
yeah, August 21st. Then I would think, if I do the math correctly, we should have plenty of money to fund where we're at and the reserves and still get to a millage rate of 7.121 ish.
Madam Chair, I'd like to know, because if you're going down that path, then what you're doing is using the dollars from the sale of a property to fund the operations of what we're doing.
Right.
Right? Well, right,
Yeah.
okay, right. Another discussion to be had is, so those dollars, they have been, that's an asset that the hospital district has had. Would it not be prudent, and this is more for the finance, I guess, the finance committee to talk about what those dollars should be used for? I think that more so than saying, let's throw it into the pot so that we can lower the millage rate or use it for funding our, what should we use, and what is the total sale again of that?
It's 4.65 million.
4.65 million. We put that in an account that could, at that, rate, use and then use those dollars that we get every year, maybe put those towards the operation, but stick those dollars away and invest. And just in case we might have another situation like we had with Thrive, there might be something else that comes up in our future, and we're here today and we're operating in a very big, like a vacuum of today. We need to be thinking, what is our trustees, and maybe it won't be you or I, certainly won't be me, what are they going to be needing to do 10 years from now? What is the Cleveland Clinic? So I don't want to look at that 4.6 million as part of the funding process. I want to look at it as an investment.
Trustee Mackey.
Yeah, well, we have investments and we have reserves. And it's all fungible, right? And I believe we also have a duty to the taxpayers. If we have this money available, then I am not inclined to raise the tax rates for property owners in this house. I can't predict what's gonna happen 5 years from now or 10 years from now, but that's why we have reserves.
I think I saw trustee Kent.
You did, and in fact, we had a finance and audit committee meeting yesterday. And we're both looking at policies, looking at our finances and looking at where we're at in the budget, and there was some discussion. I can tell you that I believe I speak for the committee when I say we worked hard and long, brought to you and kicked it around some more, but we have adopted, and I've put in front of you today, a reserve fund policy that has several components to it. And I think the recommendation from my group is, after all that discussion, here's what we came up with, and then you approve it. And to that extent, Frank, I asked Frank yesterday, he put together a little thing that shows. And again, there's gonna be that's kind of the plus and minus thing, has to do with where we're really gonna end up at the end of the year, et cetera. But basically, there's a range there fundamentally between, as you look at it, $8 and $10 million that should be set aside for the components that you've approved, that this board has agreed to. I don't disagree with what Dr. Mackin has said, what some of the interests are. If we can lower that rate, I'm all for it, but I don't want to do that at the expense of not following our own policy, which we have. Now, if when you do the math and you look at these numbers, and in this real world and this budget and these requests, you don't like the bottom line, then that's a separate issue. Then that's, we need to take a better look or fine tune. Or I didn't understand there was gonna be, an emergency contingency, and the new thing was, actually the capital reserve. Capital expenses, it's the smallest amount, but that was something that was added late because it had never been there. And we do still have a facility.
We have a couple facilities.
I mean, there's validity to everything that's being said, but I don't think there's anything to kick right now back to finance and audit. I think that as we do the math here, if you don't like the numbers, then maybe let's say it out loud, it means that all those asterisks and more.
Yeah.
Well,
We're gonna have to work through when we're back to a number if we're set on the 0.7.
I saw trustee Westcott first, so.
okay,
So I don't think the taxpayers want us to be an investment bank.
right.
And having a war chest that generates interest is probably secondary or tertiary to any concerns in the taxpayer. So I'm in agreement with Dr. Mackett. You guys, we've had conversations in the past, and I've asked some questions regarding our reserves. I think experience and necessity has informed us on our reserve policy that there probably is a margin there that is more generous than it need be. What is our deductible for our property?
I don't know that off the top of my
We
head.
still don't know that.
Well, I just say we still don't know that. I don't have.
I think that's very material because
Yeah.
it speaks to what we need to protect our capital interests, clearly. And other than that, our need to operate is payroll for staff, and money for funded agencies. So for our,
No, there's more than that.
what other than, in order to protect the community for operations, payroll, an allowance to fund our agencies, and protection of our physical assets, what else is there?
So we have our LIP commitments. We have our county share of Medicaid that we pay on behalf of the county. On behalf, so we.
Well,
pay-
those are regular budget items?
Well, they are,
budget.
and
Okay, then.
commissions, we have 3 commission lines totaling 1.6 million.
Well, that's part of our monthly operation, which would be factored into the
Understood.
3 months of operation, so don't count them
Understood.
twice,
No,
which
they
is
are,
what you're doing.
they are, yeah,
You-
I just wanted to mention all the components.
Well, okay, just to be clear, when I'm talking about our 3 months, when I read 3 to 4 months operating expenses, I'm thinking that basket would include those expenses as well.
2.1
Okay,
million.
so when, that doesn't change the concept that our 3 to 4 months of operation of funding of
Correct.
agencies, protection of the physical plants that we own, that would be insurance and deductibles, and payroll.
Mhm.
What else is there?
No, you got it,
Okay,
yeah.
Madam Chair.
so
Trustee Mack.
anyhow, so I would tend to agree with Dr. Mackett on where to go with the money that we generate from the sale. We still have a margin. And one of the things that has come to the surface throughout this process and even last year is I think that we can squeeze more juice out of the lemon with our funded agencies in terms of having higher levels of cooperation and those sorts of things that I touched on the last time. I think I won't be here to do it, so it's easy for me to say, but I think forcing us down that path is also a function of what Dr. Mackett is suggesting that we do. And I think that would be helpful whether this Amendment 3 passes or not, because I think it's going to make us more effective as well. The synergy that we get from organizations working differently together, better together, will only improve the work that's being done. So, thank you.
Yeah, and I would like at least the ballpark of those numbers going into our next discussion, because at least for me, it informs looking at the asterisks.
I'll give that to you right now, Dr. Mackett.
Okay.
So,
Trustee Jones, I see you. Let's finish this piece and then we'll come back to you.
Well, actually, I'd kind of like to hear what Frank has to say, because I was gonna
Yeah.
build on that.
okay, so as we stand at this moment, inclusive of all the consensus numbers that we just put together, okay? At 7,450, I'm just gonna walk through this high level and then I'll get to the good stuff. So at 7,450, our ad valorem taxes collected are 25.3 million. We add our investment income, and so that totals up to around 25.7. Okay, so our total income coming in would be 25.7. Our total expenses going out the door would be 26.9, which is a difference of 1.2 million. What does that mean practically? Is that we take 1.2 million out of our current, out of the September 30th investments in cash, add in the sale of the HSB, and that brings us to 10.9 with the sale of the HSB. Okay, so that's where we'd be with the sale of the HSB on September 30th, October 1st, assuming the closing happens as planned.
Assuming we fully funded all of the,
Assuming the consensus is agreed to and voted upon as is.
right,
So if we
so
go,
that's.
That's at the
point
point
I was
7,450.
that's
That's at
7,450.
7,450
Now let me answer your question, Dr. Max.
to get,
At 7,121.
right,
At 7,121, obviously, we're bringing in less revenue, so it's 24 million, 24.2 million. You add in investments, it's 24.6 million. Our total expenses are 26.9 million, so they stay the same. So what changes is the fact that we have 2.3 million coming out of reserves in cash. So that moves our reserves, moves the needle by about 1.2 million, 1.1 million. That's the difference between the 712 and the 7450. So in total, that'll leave us at around 9.9 in reserves. At 7121, if all the consensus numbers are agreed upon. 9.9 is where we would be with the sale of the HSB, all cash and current reserves at the beginning of October 1st of 26.
Thank you.
And
And
then-
in my mind, that is more than enough reserve.
And from my perspective, wanting to enforce the policy, that splits the difference between lower and upper, 3 months, 4 months.
Right.
You know, it falls in that range. And I think
Madam,
that's just an important factor.
Alan
Trustee
first.
Jones?
Well, thank you, Frank, for that explanation. My view is that the world has changed as it relates to the hospital district and maybe others. And my opinion, my analysis is that the hospital district is important in what it does to the community. And our ability, our flexibility going forward has been substantially reduced. So I think that changes the equation on the amount of reserves that we should maintain. So if we take 2.2 million out of our reserves this year in order to get to a 0.7121 rollback rate number, then our reserves are not going to be available in the future as much as they could be. So my opinion is, for what it's worth, that we ought to look at reserves differently and use them to supplement the transition that our funded agencies are going to have to make, or our inability to increase fees or support to them when they're experiencing inflationary impact. So I think that what Paul said is exactly right. Next Wednesday, I think we should go back and see if we can reduce what we're paying the funded agencies this year. I don't want to defer till next year or the year after making the hard decisions to be able to live in a world in which we cannot raise the millage to keep up with inflation. This is reality, it's what's going to happen. The question is, does it happen now, or we just let it happen gradually over time? In my opinion is we're going to have to do both. And I think we have to go back. I don't want to take 2.2 million out of our reserves this year. I want to have those reserves to be able to supplement us for a few years. And so my personal view is I don't think we're going to take any money out of reserves this year. But I recognize that we're going to have to do something. Personally, I'd rather maybe take 1 million out of reserves and maybe 1 million every year for the next few years so that our agencies can adjust. But if we take out 2.2 million this year, then next year, we're going to have to start slicing budgets even more for these agencies. I'd rather make the hard decisions now. So in sum, my view is we should go back and work on if we can reduce some of our funded agency expenditures this year and try to get whatever millage we can as minimal as possible. We're working between 0.7121 and 0.7450. But I think we're going to have to make hard decisions. The more money we take out of reserves this year, we're just deferring making those difficult decisions. I'd rather make them now and try to do it at Wednesday's meeting and maybe the meeting after that.
Can I, clarification, trustee Jones, when you say you're talking about the funding request that we are looking at now for next year, correct?
Yes.
Okay, all right,
Yeah,
so.
yeah. What I'm thinking is we ought to start making these hard decisions now and not take the money out of reserves so that it gets harder next year. I just think of it now. And doing it while trustee Westcott is there to, for either one. And trustee Deagle the same way.
Understand. Thank you for the clarification. Trustee Mack.
Not to mention me for that matter.
Yeah, thank you, Dr. Mackett speaking. So I just wanted to review the bidding again, just to make sure that I'm crystal clear. I thought I heard Frank say that after the sale, and it's 7.121, we would end up with 9.9 million in reserves, which in my mind, given the sheet that the finance committee prepared, is almost at the upper end of the band. So that's without taking another nickel from any of those asterisk.
That's correct.
programs.
That's correct.
Right.
But that's taking 2.
Oh, is that correct? I thought that 9.9 million would be reduced by 2.2.
Yeah.
No.
No.
No,
That's why I
Okay.
wanted to clarify.
Then I need to see these numbers in print. So I can-
I'll send this to you afterwards.
Yeah, okay.
This is Michael, this is a piece of information. Starting from the requests of our partners at $23,045,000. We're down, my table's right, and I think we're in a line to $21,740,000. Which is a cut of about just over $1.8 million is what the work has been in the 2 sessions that we've program by program worked through. I have no problem going back to those asterisks or others. I get, Alan, I get where your head's at. I don't disagree with Dr. Mackett. 9.9 falls squarely in between the 3 to 4 months and 10's closer to 4. From my role as treasurer and chair of the finance and audit committee, I want to make sure we stayed within here, and this is a better number than I thought maybe we'd be looking at, to be absolutely honest. So
I agree. It's a better number than I thought we were looking at even after Frank spoke. So I thought it was 9.9 minus 2.2.
no, we're
Yeah, Alan and Trud, let me just add a little bit of clarity. So if you look at the budget, we're gonna end this year, September 30th, at 7.77 million in cash and reserves. You add 4.65 to that, and you're at 12.4. Subtract the 2 million, 2.3 out of that, and that comes up, then you're 9.9. That's how you
Okay.
get to the 9.
I misunderstood what you said, so thank you for the clarification.
Trustee Deagle.
Well, that adjusts my thinking a little bit.
Please.
May I?
Yes.
So, I just wanted to bring to everybody's attention kind of what we're talking about with the 0.71 versus the 0.74. So if you have a home value, and our average home value is at about $357,000, right? Okay, $357,000. So between 0.721 and 0.7450, that would mean on average, it would be about $11.76 annually per household. That's the increase that they would have to come up with, $11.76. Not all homes are 376, some are lower, some are higher. Let's just go with the 200 to 250,000 range. That could range between $7 and $10 on an annual basis. what is that, like, I think it's like 0.3 cents, or it's about 3 cents on per day. A lot of those individuals that are in the homes of $200,000 to $250,000, I bet you a lot of them use our services. How many unique people do we have?
It's somewhere around 4,000 that.
No, no, the total for the year is gonna be about 20.
Correct. I don't-
20,000.
Yeah.
For me, I look at this and say, well, first of all, even the $11.76, and I hate to admit this, but I bought a cup of coffee that's probably worth more than that, and all of you have as well. I just don't want to short ourselves. And I want the public to understand that it sounds like we're talking big dollars here every meeting, like millions and hundreds of thousands. What this really comes down to per household could be maybe like $10 a year. That's it. We'll be able to provide more services for that $10. And a lot of those people, like the 20,000 that we've been serving, probably would be glad to have that $10 extra put into their taxes, because they're using those services. So let's don't get caught up in the millions. Let's get caught up in really what this is talking about. It's a small amount per household. We're not the county that has high millage rate, or, we are below 1. And the amount of services that we're providing for an additional $10 a year says a lot.
I look at it, I appreciate what your comments, Karen, I look at it very differently. I look at taxes as an indenture. Every dollar in taxes that are asked of the citizen to pay is a dollar that has to be earned through the time that they're working. So the $1.1 million, if you were to annualize, or excuse me, break it down, the average income for our county is $43,370, I believe. If you break that down into an hourly wage, it's 23.25. Divide $1 million by that, and you get about 47,000 man hours. That's just, if each unit of local government and the federal government looked at it that way, I think our taxation and our spending would be very different. Because we're a very small slice. So every dollar that we take, the county takes, that the state takes, the toll that you pay, the whatever, is time out of people's lives. And that's the way I tend to look at it. And I want to make sure we're as effective with our usage of other people's time in that regard as we possibly can be.
Trustee Mackett.
Yeah, and I think my understanding of this discussion is, without taking a nickel more out of any agency, including the asterisks, we'll end up at the high end of the reserves at 7.1. That's how I see it.
Trustee Mackett, you're Kent, trustee Kent.
A question that just dawned on me. I've asked this before. The law that is in effect that requires us to be at the rollback rate unless we have a 2/3 majority that would allow us to advance it up to 10%. If we stay, if we go to 0.7121, and we're sitting here a year from now, that law is going to say you've got to go to the rollback rate.
Right.
It's a perpetual motion.
Downward motion.
That
I
is going
said
to
that
limit-
at the last
That
meeting.
is going to limit the
Absolutely.
dollars that we have.
You know
Now,
it.
that doesn't mean you.
I'm sorry, I can't hear both of you talking at the same time. I really think this is an important discussion.
It just is a downward spiral. It perpetually is going to force harder decisions all the time because there's just gonna be fewer dollars unless you've got a group that says, no, we need to raise the millage, and if we had the votes to do it, you know, that could happen. It's just another variable in the mix that, just literally dawned on me. So it's in the universe now for you to think about.
So we're dealing with Amendment 3 and we're dealing with the law that Michael Kent just referred to because the Doge Energy from Tallahassee had a realization. The realization was this: our population growth is 3 to 4%, whatever, a much lower rate than everybody's budgets have been growing. Everybody's budgets have been growing considerably more because the money has been easy because property values have gone up. What has happened with this 10% margin requiring anything above it requiring a unanimous decision is making that 10%, I think, was very intentional by the legislature, because that still allows for growth with significant consideration each year that has to be justified, is going to be scrutinized, but it is in a range that is exceeding the population growth. I mean, so there was a logic to this statute when it was passed. And you know, obviously they knew what they were doing when they did it. You could disagree with why, but the strategy, they knew what they were doing with regard to the strategy.
No, they don't like special districts and they think that we're an abomination, I suppose.
Right.
I think just the opposite. I think that the work we're doing is amazing, impactful, important, and the need increases.
So-
Every day.
We are at 2:55. So this conversation is going to continue. Is there anything that trustees would like to see at the chairman's meeting on Wednesday when we continue this discussion?
Just to have Frank
Number.
We'll fill it out and send it out, so we've got that in front of us.
With all the asterisks is what the P.
Yeah, just helps.
Okay, and we'll keep the asterisks in there because I'm not to the point where we just let the asterisks go. I think you still have those
Yeah.
conversations around the asterisks.
Sharpen our pencils, I'm fine with it.
Yeah. So,
I believe Kate's minutes will reflect the discussion surrounding those asterisks that will be distributed to you before the next meeting, which would be helpful.
Packets will go out Monday
Yeah.
with
So that would be
everything,
helpful
yeah.
to refresh your memory
And
as
Frank
well.
put them on the budget.
And Paul has them marked, I know that.
Yeah, would it be?
What was, I'm sorry,
no, I was gonna do a public comment, so.
what? I know you'd send it, I think you'd send it, I don't, no, you haven't sent it. I don't know what was tentatively on the agenda for next Wednesday. This is obviously gonna be predominant.
Right.
So is there other stuff that we can back up or need to make sure we take the time to deal with?
We'll have the time.
Yeah.
Okay. All right.
It's, you left it as a limited agenda.
Yeah.
Dana's gonna talk about the HSB sale that and to VCOM, and then the discussion will be surrounding the asterisks. Final budget, we really need to get a millage rate tentatively approved.
Yeah, that's where I'm headed.
Explain that.
Yes,
This is short.
so our first budget hearing is on September 3rd. I have to create ads for the paper for publication
Statute.
prior to that meeting. They're published right after that meeting and then we hold the final hearing. So it's very imperative that all of the program requests are consensed and also a millage rate, so we can get those ads to publication, so we stay on target for that first hearing.
And the final's only a week later.
Not even 4 days.
So in the meeting invitations that we have on our calendar, that says 9 to 11. But typically on chairman's meeting, we meet 9 to 12. So did we change?
Well, I mean, I thought we,
No, we're
9 to
2 hours. We're
11,
not
2
doing-
hours, yeah.
We're 2 hours.
We've been meeting for 2 hours.
Yeah.
Sometimes we do go.
We could go.
Yeah, we could go longer.
Sometimes it has gone.
Was it a calendar invite?
Yeah.
Okay,
We should be.
I'm
spending-
sorry then, yeah, it used to be 10 to 12 and we moved it back to 9
And I thought it was 9 to 12 then.
okay,
Right?
yeah.
I do.
We don't use it all, we don't.
Okay, my apologies.
Yeah.
I can't use it.
Yeah,
Madam
Okay.
Chair, the next meeting is in 2 days, right? There is one on August 13th?
no.
Oh,
Old invite.
I just
Old
freed up my
invite.
day.
Oh,
Yay.
that's,
That's
we
time.
didn't have a quorum that day.
On the 13th,
Yeah.
didn't get taken off.
Okay,
August 19th is 9 to,
12,
let's say 12.
and then the 20th for
Yeah.
a regular meeting.
Are we good on quorum
Okay.
next week?
yeah, should be,
Mhm.
Okay,
Yeah,
just
we're-
asking.
yeah, I think unless something's changed.
Well, we're gonna really need one for which day?
Chairman's meeting on the 19th,
Yeah,
next
yeah.
Wednesday.
But I'm not here the 20th.
Okay,
It's September 3rd and September 8th that are gonna be critical days.
right, and I think we've all
Established.
managed that, that's why we moved them to when we moved them. I am updating the time for
Thank
that
you.
meeting. On the 19th to 9 to 12.
Okay, public comment. Is there any public comment? In the room? Online?
Nope, nobody's popping
And
through.
not
Okay.
So the fun.
Job, Madam Chair.
No, I'm here on. I'm here on the 8th of the final because it was supposed to be.
Well done.
I asked Jackie to make sure that I had my email addresses so that when I did a storage, I could tell you.
I leave on the.
String of texts. We gotta start with that. I hope they're gonna go. It's just stuff because of the.
Yeah, I know.
Hey, Frank?
I should be able to.
The 8th, I'm not.
For tonight.
Yeah, okay, okay, thank you.
Stop the meeting.